I thought, I'm never going to use those organs. I never planned on having children, you know, like, I might as well just get rid of them and I'm going to feel so much better. And for a while, I did.
I had top surgery when I was, it was a month before I turned 17. So I was pretty young.
Girls in the United States as young as 13 and 14 years old are having mastectomies of completely healthy breasts.
If you want breasts at a later point in your life, you can go and get them.
She said, if you want breasts later in life, you can just go and get them. Is that correct? Can you just get a new organ, mail order it, have surgeons put it in? You cannot.
I honestly don't think I was at an age where I was able to fully, like, truly understand.
The biggest contributor to the guilt for me is looking back and seeing that I got that surgery because I hated a part of myself so much.
Sometimes a patient will come in and they'll have an interior wound in their heart. Something has happened to them, typically in childhood, a lot of unhappiness, but they don't want to look at that wound.
For a while, it felt affirming. It felt like the last vestige of my femalehood, my femaleness, was gone, and I was finally a man.
The surgical and hormonal treatments now being proffered for gender identity disorders are experimental procedures. They are not evidence-based procedures.
What we know is that even hormonally and surgically treated trans identities exhibit high levels of suicide ideation. Individuals with gender dysphoria are well known to commit suicide at elevated rates. But this is true both before and after social transition, and before and after gender-conforming surgery.
It's called body dysmorphic disorder. The person will have an obsessive thought that leads to a compulsive behavior that they use to manage an interior anxiety.
I had this intense grief. I was so angry at myself for having made this decision, and I was angry at the doctors for having let me. They removed perfectly healthy organs. I got everything out. I got my cervix, my uterus, my fallopian tubes, my ovaries. I got everything removed. There's nothing in there. Perfectly healthy organs that I just decided to get rid of.
I kind of regret top surgery. And maybe more than kind of.
A phalloplasty is about creating a penis through tissue transfer. So we take tissue either from the forearm or from the leg, or sometimes both, and transplant it down to the groin area to create a phallus.
Well, as you can see here, my right thigh was the donor site, and this scar on my left leg is from the skin graft covering the donor site.
After my phalloplasty surgery, I'm right now in the hospital because I wasn't able to urinate at all for almost 24 hours. It was really scary. It was extremely painful.
In terms of masculinizing top surgery, I think 12 is the youngest who's had surgery through our program.
Top surgery is for transmasculine patients who have significant dysphoria related to their breasts.
So these are the drains, and they hook onto your bandages. Today's the day that I get the bandages off. They are so tight.
The biggest contributor to the guilt for me is looking back and seeing that I got that surgery because I hated a part of myself so much.
I made that decision and I did that at such an early point in my life. So it's just knowing that the rest of my life I kind of just have to deal with and accept this regret.
I made a really dangerous choice that I have to live with. I have to live with this for the rest of my life. And it terrifies me.